My name is Santiago Lozano. I'm one of the orthopedic oncologists at the Orthopedic Oncology Unit here at Mass General Hospital. I'm originally from Colombia, but I moved to the United States 18 years ago. I completed my training here in New York Medical College and did my fellowship in orthopedic oncology at the Harvard Combined Program at Massachusetts General Hospital, Beth Israel Hospital, and Children's Hospital. Today I'm very excited to talk to you about some of the treatment options that we have for our oncology patients. One of the most common problems that we face in our practice is the presence of primary malignant bone tumors, primary soft tissue tumors, and secondary tumors that are located in the pelvis. This is a very challenging location because the defects are usually very big and they're very difficult to reconstruct. The main goal in oncology is to resect a tumor with negative margins. After that, we deal with the reconstruction problem. In terms of reconstruction, we have different options. We can use an allograft reconstruction, which is a donor bone. As people donate their lungs, donate their retinas, donate their hearts, they can donate their bones to help other patients to regain function. These bone grafts go through a series of testing and quality proving, avoiding the risk of infection. However, despite all these technologies, the risk of infection is always present. These allografts unfortunately don't match always the anatomy of the patient. And even though there are biologic reconstructions and initially are very well accepted by the patient's body, eventually they may fail and they may sustain fractures requiring additional surgery. Another option that we have is to use metal implants, but unfortunately these defects are so big and it's difficult to get different modular implants that we could use to fit all patients. And this is where 3D printing technology has given us a lot of help in the treatment of our patients in these past 2 years. 3D printing has become a technology in which you can create any type of implant based in the anatomy of the patient. And what we're using now is generating with a CT scan of your own body a metal piece that is going to recreate the part of missing bone that we have to resect because we were treating either a primary bone tumor of malignant characteristics or a malignant soft tissue tumor. This process requires planning and requires a team effort with engineers and with the companies that develop this type of technology. After you get seen in our unit and you start other treatments such as radiation or chemotherapy, in the surgical side, we do the planning stage. That includes a meeting with the engineering team in which, with imaging studies, we look at the location of your tumor and what cuts need to be done to resect the tumor in a safe manner, achieving those negative margins that I was mentioning. For that, we use custom-made plastic guides that are based in the anatomy of your body. I'm going to show you the case of one of our patients that underwent this type of surgery. In this initial graph, you can see the images of a CT scan that was translated into a designing program. And you can see in different colors, especially in blue, the location of the tumor. In the red color, you can see the areas of bone that we want to resect. So all the red color is covering the blue color. That means to get negative margins. You see in green color, geometric figures that correspond to the cutting guides. These get fixed in your anatomy during surgery, and they help us to give accurate cuts, resecting the tumor in a safe manner. We combine this technology with another type of device that we call CT-guided navigation. With that, we increase the accuracy of our cuts and the safety of your surgery. In this second image, you see in green color how the prosthesis will look. And you see in green color the trial of that prosthesis that in the case of this patient is replacing the acetabulum of the pelvis. The acetabulum corresponds to the socket of the hip joint, in this case the right side of the patient. In this image here, you can see the implant per se and how it fits the anatomy of the patient. You see that it has different points of fixation and recreates all the anatomy to the places where it should be. This increases the function of patients and facilitates their recovery. Lastly, you can see in this one how is the trajectory of the screws and how we plan the sites of fixation of the implant into your own body. Having this pre-planning facilitates an easy performance in the surgery and decreases the likelihood of difficult steps and complications. For better view, I have a higher close-up of the size of this particular implant without the screws, and here with the screws. This technology facilitates to recreate your own anatomy, and because of the different points of fixations and the durability of this metal, we can start your rehabilitation process faster, allowing you to put weight in the extremity where you have had surgery. The outcomes of this prosthesis so far have been very good and the rate of complications low compared to other types of technologies that we have used for reconstruction. We'll be happy to discuss this in more detail and explain it to you for your individual case as needed here in our service.
Hi, my name is John Mullen. I'm one of the surgical oncologists here at the Mass General Hospital. And I'd like to tell you a little bit about how we function as a team in the care of patients with large, complicated tumors of the pelvis. So pelvic tumors frequently involve multiple structures because the pelvis is a very confined space. So tumors of the bone or soft tissues of the pelvis frequently involve major blood vessels to the limbs and can also be in close proximity to other important structures like the rectum or the bladder. As such, we've assembled a team here to help deal with these complicated tumors. Your team will frequently involve an orthopedic oncologist who specializes primarily in bones and soft tissues. Frequently will involve me or another surgical oncologist who has a bit more familiarity with the management of the bowel as well as the blood vessels, and sometimes even a urologist if work on the bladder or prostate is necessary, and a plastic surgeon to help with reconstruction of any wound. Specifically, I've been doing this now for about 10 years, and I've worked closely with the orthopedic oncologists here managing complicated pelvic tumors. And my role tends to be management of the intestines as well as the blood vessels, such that these tumors can be removed safely and with a clear margin. We've really assembled a team that functions very efficiently and effectively together. And in this way, we've really been able to achieve outcomes that I think rival any of those throughout the world. And I'm pleased to be a member of the team that cares for chordoma patients. Chordomas are very complicated tumors that require really a team of surgeons in order to safely remove them. Our team of orthopedic surgeons, of course, are the primary surgeons, and they're very skilled in removing the bone, the nerves, etc. However, these tumors are often next to important structures like major blood vessels as well as the bowel, and those are two things that I deal with on a more regular basis. And so we've put together a very organized and highly functioned team. And my role on the team primarily is to help with the exposure to the chordoma and as well to remove segments of bowel, create colostomies, and as well to control the blood vessels to the tumor so that the tumor can be removed safely without major bleeding. I've been doing this now for about 10 years, and we have a large experience here at MGH taking care of these tumors. It's really been a pleasure to work with the other members of the team, and I think you'll find that with this experience and familiarity, we've become really leaders in the treatment of these tumors on a national and even international basis.